Okay, good morning, doctors. Welcome to this morning's program. My name is Dr. Kronk, and we're just getting in the mechanics right now of setting setting the system up. So I need just one more second, and go ahead and all right. What I need someone to do right now is just make sure that our audio is good this morning. So if you could just type into the question box, hey, look, the audio is good. We can hear you just fine. Go ahead and just type into the question box. We can hear you just fine, and we'll get started. All right, sounds fine. All right, great, doctors. So welcome to this morning's program. I'm really excited about the program this morning. Let me get back here. Anyway, I'm really excited about the program this morning because I've got a really special guest with Spinal Kinetics. We're starting to bring in industry experts in each area of individual expertise. This morning we're going to talk about patients with chronic pain from spinal ligament injuries that may need weight loss to eradicate the pain. And I've got a very special guest. I've got the Global Weight Loss Program Chief Operating Officer, Adam Slazer, online with me this morning. I'm going to introduce him a little bit more further, but I think you're going to be very impressed with just how much practical experience that Adam has in the space of weight loss. Now, sometimes, as Spinal Kinetics, doctors have asked me, well, how do these things relate? Spinal Kinetics is excellent at being able to get and target and diagnose spinal ligament injuries. And we do that through a spinal instability examination that actually completely pinpoints where the patient is having their problem. So you can very specifically diagnose the problem that causes a lot of different symptoms. So if we look at the symptoms today of neck pain, of migraine headaches, of low back pain, and again, hold on, let me get this out of the way. So look, migraine headaches, lower back pain radiating down the arms, pain radiating down the legs, shoulder pain, scapular pain, ear pain, facial pain, numbness and tingling, a sense of weakness and heaviness in the arms, same thing in the legs, severe fatigue, concussive syndrome, disturbances in concentration, disturbances in memory, difficulty in breathing, difficulty swallowing, loss of voice, visual disturbances, ringing in the ears, sinus congestion, bladder and bowel dysfunction. Those are all Medscape indications and symptoms of spinal ligament injuries. So at Spinal Kinetics, our science-based injury technology can help doctors pinpoint the actual cause of that condition, right? And we help doctors to be able to better pinpoint and target what they're going to do through manual therapy called spinal adjusting. And we know that this spinal adjusting process works because of an algorithm. And that algorithm is based on getting the mechanoreceptors back online and getting what? The inflammation reduced. But here's the problem, right? Some patients will have a problem and go chronic, right? In other words, they'll have a difficulty when they're either slowed in the progression of your care or they're not getting rid of it altogether. And what's the biggest thing that we know today? We know that BMI, body mass index, and obesity can be a problem. Everybody's aware of that problem today. There's not really any doctor, I don't think, on the planet that doesn't understand this concept. Now, if you look at the guy to the right, now this could be a woman, this could be a man. In this case, it's a male. But if you look at this guy to the right, this is 50% or 75% of what walks into your clinic injured. Right? If we go to the 25 to 29%, which is just overweight, we probably pick up another, I don't know, 35 to 40%, and about 10% probably comes in with a normal BMI. Now, we know that BMI causes syndromes. Doctor, you're very familiar with metabolic syndrome, syndrome X, cardiometabolic syndrome. These are all chronic inflammatory conditions in the body. Now, if you have a inflammatory condition at a spinal level, but it's being overwhelmed with an overall body inflammation, then you can have a problem. Now, we know today from the Mayo Clinic, if you're overweight, reducing your weight by 5 to 10% decreases your chance of developing disease, close to 50%. So we know that there's an obesity epidemic. If we look at it, the AMA in 2013 declared obesity an actual disease now. We know that 70% of Americans are overweight, 50% of Americans will be obese by 2025. That means over a 30 BMI. 57 million are pre-diabetic. So all the conditions that you look to in your clinics as doctors of chiropractic, you're already treating, but you cannot treat heart attacks or premature death or high blood pressure, gallstones, degenerative arthritis, type 2 diabetes. These are conditions that are seriously increased with an increase in BMI. So it's very easy to actually kind of look and say, is there an association between chronic pain and obesity? If you're treating injured patients, the biggest thing you want to reduce the chance of is chronic pain. And you've got to get rid of the chronic pain as early as possible. Or if you're working with chronic pain patients, obesity becomes a thing that actually seriously can hold up the results in treatment, but also if reduced can seriously, if you can reduce the patient's weight, can seriously improve results. So I asked Adam to send over some images of just some pre and post images of people that they actually had through their programs before, just to give you an idea. And you can see these. You've seen these with other weight loss programs, but it's good to actually take a look and go, okay, do these programs actually get results? And I think it's really easy to see that these programs do get results, and dramatic results. And when you get the type of dramatic results that you're looking at here, those results are something that become life-changing for the patient. These patients become a great source of referrals. I asked Adam to send over, just a couple of images. They have a weight loss program that is very, very easy to implement into a clinic. Adam today will talk about just how easy that is, and also the kinds of incomes or the kinds of profitability that these things are, because they're highly profitable, as long as you decide that you would like to put something, weight loss into your clinic. When I think of weight loss, or think of weight loss going into my clinic, I would definitely think about how easy is it. Things like, can my staff do it? And can we easily add it as an additional therapy into the clinic? And is it how little or how much does it cost me to actually implement it? So in part with our series as with Spinal Kinetics, we are starting to bring industry experts in. And I don't think there's probably a larger or more veteran person in the country. Now, you may not have heard of Adam Slazer's name, but Adam Slazer is the COO of the Global Weight Loss Program, and he's assisted over 25,000 patients. Now, I didn't say 200 patients. I didn't say 2,000 patients. I said 25,000 patients. He's assisted through programs that he's been a part of. He's assisted over 400 doctors with doing weight loss within their centers in some way or another. He's worked with doctors in America. He's worked with doctors in India. He's worked with doctors in Canada, because the Global Weight Loss Program is an international weight loss program now that's being taken out to other countries. So with no further ado, what I want to do is introduce you. We're going to do, Adam will be we'll be going back and forth with Adam Slazer right now in an interview. So I'd like to introduce Adam. Adam, good morning. We're so happy to have you. Really happy to have you on our program this morning.
Thank you, Dr. Cronk. I appreciate you having me. I'm excited to be here. I think this is something that, once the doctors can see the value of what we're trying to do and how easy it is, I think it'll help formulate a better opinion of weight loss and implementing it in their office.
Right. So, just I guess to start off with, let's talk about how easy is it to put a weight loss program into your clinic?
Well, that's one of the biggest issues. I mean, doctors cannot split themselves in two, and they're already overworked, seeing patients. And what I'll tell doctors is, look, you didn't go to school to open up a weight loss clinic. You went to school to become a chiropractor and practice chiropractic and help patients in that way. So what we've done at Global Weight Loss is we have made this program 90% staff-driven. Now, that's not to say that a doctor can't be more involved. We have doctors that are 100% involved, and then we have doctors that, again, let their staffs run it. But it is the doctor's choice, and I think that's what doctors appreciate the most about the Global Weight Loss Program is they can put 3 to 6 hours in a week and have a multi-million-dollar a year income in their clinics. And I think that's what excites doctors, and the way we've done it, I think, is the most exciting, because when you get into your car and you start it, you're not worried about, is the battery going to work, is the muffler functioning, is the transmission going to go and drive. You just start the car and you go. And that's what you get, with the Global Weight Loss Program. Everything is included, down to your advertising and marketing. There's videos that you can watch. There's trainings that you can do. So what we've done is we basically made it so simple that a first grader could probably run this program, and be successful with it.
Sure. So, okay, so if you've made it that easy, we're gonna get into talking just a little bit about how the program works here in just a second, but since you brought up this idea of, just how easy it is, tell me, so if right now I have your website up, if a doctor wanted to get involved or get more information about your program, what's the best way to do that? I mean, if we're on here, is it just to...
Yeah. Yep. And again, guys, this is kind of like you're looking at the skeleton of the information. It's very basic. There's not a lot because this program is doctor supervised, someone can't go on our website and purchase it. They'll only get the zip code of a doctor in their area, where they will be able to purchase it. But if a doctor is interested, basically they would fill out the contact form. And we would give them access when you go down to that website and you see doctors. There's a doctor box there. We'll give you access to that portal. On that portal, okay, you will be able to watch videos. You'll be able to view all of our marketing materials, all of our advertising materials. You'll even get videos on how to implement the program. You'll learn more about our relationship with every Quest and Solstice lab in the country, so that if you chose to, you could do pre and post blood work. I mean, everything that you need to start the program is there, either in a PDF file or a video or an audio question and answer. And that's what doctors like, is they don't want to have to figure everything out. Everything is figured out for them. And once they reviewed that and they were interested in purchasing as little as one program, let's say they have one patient that they wanted to try this and see if it worked in their office, and just letting you doctors know our best doctors are products of the product or have staff that's product of the product first, and then they see if it works, and then they become believers, right, Dr. Kronk? And then what happens is we schedule a training, whether it be via Skype or GoToMeeting like we're doing now, or we'll come out personally if you purchase, a large enough amount, and we'll actually do a training with you in person. And then you get us, me or my staff, primarily me, 24 hours a day, 7 days a week, to help you run through the program if you ever do run into any issues or have any questions that you can't, answer with your patients. So again, everything is done. We help you accomplish everything. We'll even provide you with some white label marketing material that you can then take to any Staples, Kinko's, or your printer and get that going where you can advertise it in your office. So we really try to, again, make it a weight loss in a box, so to speak.
Sure. Okay, so, it brings up a couple of good points. One is, doctors, just in case you don't know, I've gone through this weight loss program myself. When I started on the weight loss program, I was 276 pounds. I dropped down to 251 pounds, which was 25-pound amount of weight loss. Currently, today, I'm around 243 pounds, which took me out of the obese, still keeps me in the overweight category, but not in the obese category anymore. So I know that this program works and it's very simple. You know, as far as a consumer, it's very simple. So, you know, what Adam is saying is that, you know, you want to be the product of the product. If you have people in your own clinic, yourself, your wife, you know, staff, that's the nice thing about handling or keep bringing in weight loss clinic is a lot of time, weight loss aspect to your clinic is a lot of times people right there can not only need it, but become very good products of this product. And Adam, if they want to sign, so you mentioned if they wanted to sign up for one, they wanted to try it on one patient, what is the cost of a kit? Because I know that there's weight loss programs. Well, I know there's weight loss programs out there, Adam, where they'll, you know, they'll have you buy into, you know, $2,500, $3,500 worth of supplies, and you know, you've got all this upfront cost, and then you've got all these. You know what I mean? Talk to them a little bit about it.
And again, that's what we really try to cater to the chiropractors, because that's what we wanted to avoid. It's not a multi-level marketing company. There are no franchise fees that we're going to whack you with. There's no computer, you know, back office portal fees. We allow you to register your patients on their patient portal so they can watch the videos. And the bottom line is a basic kit can start for as little as $227, and the average retail on these kits is $797. Now, we have doctors selling it for a lot more than that because they're adding other services into the program itself to kind of beef the program up. We offer programs for vegans as well, if they want to do like additional supplementation, or you have a type A patient that is working 80, 90 hours a week and you want to supplement some proteins in there as well, we can do that. And those doctors are doing that because A, they want to help their vegan patients, but B, they also want to help, you know, add some more muscle to the program, and by adding more muscle, it allows them to add more cost. So we have a lot of doctors doing a kit with additional supplementation that some of these doctors are charging as high as $2,197 per program. So again, it really just depends on you, your practice, and that's what we really want to try to get to know the doctors, learn more about their practice, and figure out what program is going to work best. All of our programs include liquid nutrition. All of our programs include a fiber product that helps patients when they're hungry. I mean, there's so much. They're not just getting the quote-unquote weight loss product and then being left in the dark. There are all these supplementary products that have been added in to ensure your patient's success. And again, that's what I think is best about it, is it's not just saying, here, take this and good luck. It's an actual mapped out plan with specific products to ensure that your patients are successful. And Dr. Kronk, congratulations on your weight loss. Our average weight loss is 15 to 40 pounds per program. So, I mean, it's pretty impressive. It's pretty impressive stuff.
Now, when you say those types of weight loss, you said 15 to what? 40 pounds?
15 to 40 pounds. And again, guys, I can't put global fat loss on the bottle. That just won't sell. It's, you know, weight loss sells. But the difference between our product and all the other products out there is our product is specifically designed to harness the power of the hypothalamus and redirect the body into burning abnormal fat. So, you know, you're going to be losing 90% of the weight that you lose is going to be fat, not lean muscle, not water weight. And if you go back to some of those before and after pictures, normally if you had someone that lost, you know, over 80 pounds in a 6-month period, you know, God forgive me, they would look like they were ill or they were in some type of prison. On our program, because the weight is pure fat, these people look healthy, you know, and they look vibrant, and they don't look like they've been on a diet that's where it's taken every bit of energy out of them to be successful.
Totally got it. Okay, good. So when you say, though, 15 to 40 pounds, and you say on one program, what is the time involved there, Adam? How long is the patient?
Well, I always tell my doctors very simply, it takes 21 days to break a habit. We tripled it. So it's a 63-day program or 2-month program. It's, again, the products are all natural, so that it's not a drug, so there's no contraindications with any medications that your patients currently may be taking. You've got a reduction phase, and you've got a maintenance phase. And the great thing about it, doctors, is your patients are eating real foods. They're not eating anything processed, packaged, freeze-dried. They're not eating any of those type of foods. And what the greatest thing about this product is that after the maintenance protocol, if your patients were to follow this program, continue to follow just the maintenance protocol, 70% of the time, they would never need another weight loss program again.
Wow, that's amazing. And I know exactly what you're talking about, Adam, because what the program did is it taught me timing, and it taught me how to eat, when to eat, and it taught me some principles that once you understood the principles, you just said, okay, if I want to go against these principles, I'm going to gain weight. If I want to stay on these principles, which are easy to do, and you're not hungry, then I don't gain weight. So, real easy to do with that. I want you to spend just a little bit of time, because I know that busy doctors are busy, and the first thing they think about is, okay, guys, I got another thing to implement. But when you say this is staff-driven, kind of give the doctor an idea. Hey, the doctor sees the patient to explain it, and then what happens, and how does it become pretty much staff-driven at that point where the doctor's not even involved?
Yeah, I mean, basically that's a good question, and it's real simple. Basically, the doctor is there maybe for the initial consult, or maybe for the initial workshop. After that, it is doctor supervised, though, and staff-driven, as you said. So when the patient comes back weekly for their weigh-ins and assessments, staff member is going to do that weigh-in and assessment. And by the way, we've got a system in place where your patients are in and out of your office for a assessment in 3 to 5 minutes tops. So they're not there for 30 minutes every time they come in, because we know your staff is busy too. Also, the staff would then be responsible for any follow-up calls that need to be made, any weekly emails that go out. We have practices that send out a weekly email, that send out a weekly text message to make sure that the patients are doing okay. They will follow up with the patients during the most important times of the program. So the staff will follow up with the patients on day 3 and on day 7, because those are the most critical times to make sure that they're off to a good start. Because doctors, if your patients are doing this right, they will lose up to a half a pound to a pound per day. It's that simple. And why do people stop weight loss programs? Because they're not successful. So if your patients are seeing results on a daily basis, okay, they're going to continue using the program. But that being said, we do have a 10-day open bottle money-back guarantee, where if a patient does just happen to have a reaction, which is very rare, it's maybe 1 in 25,000 cases, or there's something that's not right, you will be able to reimburse the patient, and we as a company will reimburse you. That's how confident we are that this program is going to work. So everything is in place. Your staff would watch the videos along with you, learn how to do it, and then they would really be the people implementing it. You would only be involved to kind of manage what the patient was doing in terms of how they were doing their weight loss. And if there was an issue, like if a patient said, I need to speak with the doctor about something, you would be there. So just to give an example, we have a doctor in Wisconsin that's doing about 100 to 150 programs a month, and he probably spends 5 to 9 hours a week on our program. He has it down to a T, where he's got his staff running it in the office that he's in.
Right, and I've actually talked to that doctor, and it is amazing. Plus, Adam, he's really, when you talk about how much additional revenue can be earned with a clinic, I mean, if you're doing 100 to 150 patients a month on a weight loss program like this, I mean, you're talking about millions of dollars worth of additional services in the clinic, correct?
Absolutely. He will make over $2 million a year. He will make over $2 million, this year. Made about 1.5 last year. And here's the beautiful thing, Dr. Cronk. When you have a patient or someone that comes in that isn't a patient, and they lose, 15 to 40 pounds in 63 days, do you think they'll be more open to the other services that you offer in your clinic?
Yeah, absolutely.
Absolutely. So the money that doctors are making on their true services that they offer, chiropractic, laser, neuropathy, is gonna dwarf what you would make on the sale of a weight loss program. But the bottom line is that weight loss program got them in the door, got them to see you, and now if you can get them off a couple of medications, save their life, believe me, they're going to be excited to look at the other options that you offer in your clinic.
Right. Plus, the other thing I guess I'd end with on that aspect of it is doctors, the doctor that Adam is talking about, I mean, the town or city, I guess, whatever you'd want to call it, that he's in, is around 50-some thousand people. Okay, so these are not big, broad metropolitan areas that he's operating in. So this can be, you can have a very successful clinic within a small town or a large city. It doesn't really matter. So I guess what I'd like to do, Adam, is there anything else that you want to talk about? Because what I'd like to do is open it up to questions for the doctors.
No. Yeah, absolutely. Yeah, let's open it up because I want to try to answer, as many questions as possible, and get these doctors excited about, what we're offering. So let's do it. That's fine.
Yep. Okay, so doctors, what I want you to do at this point is if you have any questions, go ahead and type those questions into the question box. We know you're busy. I try to keep these webinars down to about 30 minutes and then a Q&A. So if we've got questions this morning, please, by all means, go ahead and ask. And I will read your question, and I'll have either myself or Adam answer it. Okay, first one is for me. Dr. Kronk, when would you see this in the treatment process? Well, here's the thing. When I see this in the treatment, a couple of different ways I'd see it in the treatment process of an injured patient or in a chronic pain patient. Chronic pain patient is really easy to see in the injury patient. Let's say an injury patient was not fully recovering, okay, and you thought that weight loss could be something that would help them, just like if you sent them to a gym and they started to exercise. There's a lot of different things that you could do for a patient to assist them. And if they thought that, okay, great, at that point you thought that you could help them with weight loss, then I would introduce a program there. Now, I would also introduce that it's not, this is not a program, you're not billing it to an insurance carrier or anything else, but you feel it can help. You sit down and actually have a conversation with them about this life change could make a change that makes the significant difference that's going to change how they are for the rest of their life. You got to remember, if a chronic headache patient or chronic pain patient, a chronic low back pain patient has chronic low back pain, the American Pain Association says that they're going to spend $9,000 to $19,000 per year medically managing. Okay, so, what's ahead of them is very large expenses. You take a migraine headache patient that has migraine headaches or has chronic headaches as a result of their trauma, and you want to see if reducing down their weight doesn't improve that, which just about every condition I'm familiar with improves in some way with weight loss. Those folks spend about 70% more in medical expenses a year. So if you're talking, an $800 to a $1,500 program, it's pretty simple. Now, if you wanted to, you could write it up and say, look, that was a recommendation based off of their injury and what I felt I needed to actually have them do for injury work, and then they can put the cost of the program that they paid you into the settlement as part of their treatment costs. You're not handling it. In other words, it's not coming out of pocket. You're not waiting on settlement. They're paying cash for that in advance, but they're putting it through on the settlement. On the chronic pain patients, real easy. Chronic pain patient is not reducing down, then you start to, they're not reducing down in, say, by month 2, you start to actually introduce it, or you can even introduce it real early on. It just becomes that simple. Plus it adds another revenue stream, but 2, it adds another portal of entry for patients into your clinic. Some patients might want to come to your clinic because they're interested in weight loss, and as soon as you start putting products out into the community where people have noticed that people have lost weight, Adam, what happens?
Well, again, like just to give an example, the average referral rate for these practices is 30 to 40%. So, you know, we'll help you create a referral program in your practice, but eventually it just takes on a life of its own, because what happens is word of mouth spreads. If you have a patient that loses, say, 10 pounds in 10 days, people are going to start noticing, and they're going to say, "What are you doing?" And you can go, "Hey, I'm doing this program that's doctor supervised. It's not like I could buy it on the internet or you know, I bought it on TV. This is something where my doctor is managing it, and there's a level of accountability and there's a level of respect in terms of it being a doctor supervised program." And then the program kind of just sells itself. It kind of just takes on a life of its own. So, you know, it really is a simple program to implement. And once you get a couple of success stories, you can always promote that in your office. You can, you know, have some things out that patients can see. We have a slide presentation, like a little loop that you can put in your office, and you can add these before and after pictures. And these are things that really, you know, gauge the interest. You could tell somebody something works, but if they see it works in somebody else, or they see it has worked for other people, then the rate of closure is going to be 1,000% higher. And that's usually what happens with our program.
Sure. Okay, good. So here's a question. How much does it cost to start again?
Basic kit can run as low as $227 plus shipping. And that will give you access to the doctor portal. And what I've done for these doctors, which I don't mind doing, is I will play the doctor if they decide to go on the program. So let's say I get a call from a doctor. He says, "Adam, I'm interested in the program," or "My staff's interested in the program, and I really want to try it." Great. I'm not only going to send it to you and train you on how to do it, I'm going to be the one managing your case. So that means you're going to get me, texting, emailing, calling, to make sure that you're doing well on the program. I just had a doctor in California start, him and his wife. He needs to lose 40 pounds. First weekend, he's lost 8, she's lost 4. He's happy. He's getting more and more excited about the program. We also had 2 clinics, another one in Oxnard, California, and another one in Gainesville, with these huge staffs, 9 to 10 people on staff starting the program, and they're all doing it together, and they're all having great success. And this gets the doctors excited, because when a patient comes in and sees that a staff member has lost weight, they want to know what that staff member did. And then again, it leads to patients purchasing the product with minimal marketing. If you can get it started with minimal marketing and then build it up, we obviously have a marketing company that we work with that can help you do more target advertising. But if you're not there, you can do it on a very grassroots level and be very successful with it. And I think that's the exciting thing for doctors.
Okay, perfect. Okay, that's absolutely perfect. And so the question here is, where do they go again on the website? So if they go to the website and they go to the question was, where do they go on the website? Am I on the website?
Yep. You would just hit click here to sign up for a free consultation. And that should lead them. I don't know why it's not working, but it should. There you go. It should lead them to a contact us field, and that all will come to us, and we'll get back to them. Or they can call me directly, or they can call the number that's right there on the website, and I will personally, speak with them, answer any other questions that maybe we don't have time to get to on the webinar, and make them feel comfortable with our program. And I always tell doctors, because doctors like patients, some of them have been burned, with these weight loss programs before, with, like you said, Dr. Kronk, having to invest large amounts of money, in programs that just don't follow through. And what I tell doctors is, and I say this to patients too, it's okay to be skeptical, just don't be cynical. Let me explain to you how it works. Try it in your practice and take it from there. The great news is you could buy in bulk. You could buy 10 to 20 kits to start if you really wanted to launch it with your staff and with patients. And the great thing about it, as you've heard about the prices that you can charge, you don't have to sell 100% of your inventory to break even. you could sell 20 to 30% of your inventory, and you would not only break even, but you would make a profit. And I think that excites doctors too, that they're not locked in to having to sell all these kits. They can do it as they go, and we can offer better pricing and better marketing materials if they do purchase in bulk. Okay,
perfect, perfect. So, doctors, I'm just scanning through here. I'm not seeing any other questions. So hopefully, the presentation has made it real clear. I would highly recommend that you go and contact Global, put a contact form in with the Global Weight Loss Program. To me, it's kind of if I were in private practice today, it's pretty darn easy. I definitely would have a weight loss component to my practice, just simply because it benefits too many conditions. There's too many conditions that you see in your own private practice that can be benefit from weight loss. Weight loss is real easy to put in. I've seen this program. I looked at it. I was involved with it when it first came out, and looking at it, and it just is a very easy program to implement. So, Adam, I really thank you today for your time. I know that you're a busy guy, and I know that you're doing a lot of things there. We had a chance to chat a little bit beforehand with all the various things that you're doing, but I guess for myself and for the doctors that are on the program today, just thank you very much for your time. We very much so appreciated it.
My pleasure, and again, feel free to reach out. I look forward to seeing more of you, but less of you.
That sounds good. All right, doctors, thank you very much, and have a great week.